everyone, I am Dr. Shruti, Assistant Professor in the Department of Oral Medicine and Radiology, Sibar Institute of Dental Sciences. Today let us learn few aspects about the general physical examination. General physical examination is very important before we start up with the dental examination or a dental treatment, because it's very important to know about the systemic condition before you plan a dental treatment, as it's going to influence the outcome of the treatment. And also it can also present, normal systemic illnesses can also present as oral manifestations, which we will be the first persons to see. So let us learn about how to evaluate pallor, icterus, clubbing, cyanosis and edema in today's lesson. Pallor is the paleness of the skin and mucous membranes. Pallor is usually a sign which indicates the reduced amount of hemoglobin content in the blood. Pallor can be evaluated by examining the oral mucosa, the palpebral conjunctiva. The conjunctiva can be examined. Pallor is the paleness of the skin and mucous membrane. It usually indicates the reduced amount of hemoglobin content in the body. Pallor can be evaluated by examining the conjunctiva. Now the conjunctiva is of two types, the bulbar and the palpebral. The one that lines the eyeball is called as a bulbar conjunctiva, and the one that lines the your eyelids are called as the palpebral conjunctiva. The pallor can be examined by checking the palpebral conjunctiva. Both palpebral conjunctiva needs to be examined, the lower and the upper. When you are examining the lower palpebral conjunctiva, you need to retract the lower eyelid and ask the patient to look upward. This is how you examine the lower palpebral conjunctiva. And the upper palpebral conjunctiva, you retract the eyelids upward and ask the patient to look downwards. This is how you examine the pallor in the conjunctiva. And it can also be by checking the nail beds and the oral mucosa, which will be dealt in the oral examination. The second one is icterus. Icterus can be examined by checking the sclera. Icterus is said to be positive when the sclera turns yellow, and it indicates the increased bilirubin levels in the body. Now the whitish part of the eyeball is called as sclera, and that needs to be evaluated. You ask the patient to look forward and check the sclera. Bluish colored sclera can also be seen in other conditions like osteoporosis, osteogenesis imperfecta, Marfan syndrome and Ehlers-Danlos syndrome. Now moving on to the third one, that is clubbing. Clubbing is the thickness of the nail bed area. Now you get to see this condition positive in the systemic illnesses like any kind of liver diseases or any kind of pulmonary disorders. Now you have to examine the angle between the nail bed and the nail. Now that angle is called as a Loewe bond angle. General conditions, if the angle is 180, 160 or below it, is considered normal, and a slight increase in that angle is considered to be positive. And the next method is to evaluate the Shamrock's window. Now the Shamrock's window is nothing but you get to see a small lozenge-shaped space when you ask the patient to oppose two fingers against each other, two index fingers against each other. Now if you get to see that space in between those two fingers, that means the patient is not having clubbing. Now if that space is obliterated, that means the patient is having clubbing. Okay, now these are the two methods to evaluate clubbing. Then moving on to the next one, that is cyanosis. Cyanosis is the bluish discoloration of the skin and the mucous membrane. Now there are two variants of cyanosis. One is central and the other one is peripheral. Central one can be evaluated by checking the discoloration in the tongue, lips and the oral mucosa, and the peripheral ones by looking at the peripheries. Moving on to the last section of the video, that is edema. Edema is the accumulation of fluid into the subcutaneous tissue. You get to see a generalized edema or a dependent kind of edema. Where generalized, the entire body will be edematous, and the dependent one, you get to see the edema because of the long postural variations, most commonly seen in the in the legs, that's called as pedal edema. Now in cases of acute nephritis or in cases of mixed edema, the patient presents with the edema of face. Now in the nephritis, in the acute nephritis cases, the edema reduces as the day proceeds. Pedal edema, you get to see a swelling in the ankle region, and the swelling appears to be glossy and shiny, assessed by applying gentle pressure on the dorsal aspect along of the ankle region. If it is pitting, you get to see a kind of depression in that region.